evidence produced by health promotion research.
Health equity begins with research.
Research empowers communities to thrive.
Is able to strengthen public health efforts.
Funding it means supporting informed health policy reforms.
Investing in research means investing in the future.
It ensures that health promotion programs are effective and contextualized.
Health promotion research guides policies.
Research protects rights and well-being.
Health promotion research empowers Filipinos to live healthier lives.
It helps us become better advocates.
It guides us why we do what we do.
The future is health promotion research.
Policy must be rooted in evidence produced by health promotion research.
Health equity begins with research.
Research empowers communities to thrive.
Is able to strengthen public health efforts.
Funding it means supporting informed health policy reforms.
Investing in research means investing in the future.
It ensures that health promotion programs are effective and contextualized.
Health promotion research guides policies.
Research protects rights and well-being.
Health promotion research empowers Filipinos to live healthier lives.
It helps us become better advocates.
It guides us why we do what we do.
The future is health promotion research.
Policy must be rooted in evidence produced by health promotion research.
Health equity begins with research.
Research empowers communities to thrive.
Is able to strengthen public health efforts.
Funding it means supporting informed health policy reforms.
Investing in research means investing in the future.
It ensures that health promotion programs are effective and contextualized.
Health promotion research guides policies.
Research protects rights and well-being.
Health promotion research empowers Filipinos to live healthier lives.
It helps us become better advocates.
It guides us why we do what we do.
The future is health promotion research.
Good afternoon, everyone. Welcome to the Health for All, Even Behind Bars, Towards Health Promoting Detention Facilities webinar in observance of National Consciousness Day for the Elimination of VAWC yesterday and the 18-day campaign to end violence against women, which also started yesterday and ends on December 12th. This webinar is brought to you by the Health Promotion Program, National Institutes of Health, University of the Philippines, Manila. We are happy to have your participation today as we learn more about the unique health needs of women in detention and explore future directions to understand how these needs are considered and addressed. As mentioned earlier, we are observing the call of the Philippine Commission on Women for the 18-day campaign to end violence against women. Violence against women and girls remains one of the most pervasive and deeply entrenched human rights violations globally. It is a manifestation of systemic gender inequality, reinforced by harmful social norms, discrimination, and imbalanced power dynamics that continue to place women and girls at risk. Ending VAWC is a collective responsibility that calls on all of us to stand with women and girls in building a safer and more inclusive society. And before we start, we are reminding everyone that the views and opinions in this webinar are those of the speakers and do not necessarily reflect the official stance of the Health Promotion program, its affiliates, or its partners. This webinar is also being live streamed through the Health Promotion Program's YouTube channel. You are informed that by staying in the Zoom room, your likeness, image, and voice may be recorded and captured through the official live stream video. And to maximize the limited time we have together, please take note of some of our house rules for this session. So please message any of the organizers for assistance with technical concerns. For any questions directed to the panelists, you may type these in the Q&A function. If you have any trouble finding this, please let one of our organizers know. This webinar is being recorded and will be uploaded to our social media platforms. By staying in the room, you consent to have your likeness recorded. To receive your certificate for the session, it is required for you to register, attend via Zoom, and answer the evaluation form, which will be shown towards the end of the webinar. Now, to officially open our webinar, we have the Health Promotion Program's Program Lead, Dr. Catherine Ann Reyes, to give us the opening remarks. Doc Cathy, the floor is yours.
Good afternoon, everyone. And I'm happy to welcome all 92 of us here in the Zoom room. Thank you for joining us today and to really explore this topic and really understand also what it means for us to commit health for all. And that includes those even behind bars. And the conversation today aims to really talk about towards health promoting detention facilities. As mentioned earlier, this is being held in observance of the National Consciousness Day for the Elimination of Violence Against Women and their Children, as well as the 18-day campaign to end violence against women. So both of these occasions remind us of our collective responsibility to protect and uplift the rights, dignity, and well-being of all women, especially those whose voices are often unheard. Today's event reflects a core principle at the heart of the health promotion program that every person, regardless of circumstance or setting, deserves the opportunity to attain the highest possible level of health and well-being. This afternoon, we focus specifically on women in detention. We aim to deepen our understanding of what an ideal health promoting detention facility is, specifically from the perspective of the needs of women, explore the distinct and often complex health needs of these women who are deprived of liberty, and hear from experts who bring insights from research, policy development, and frontline implementation. Our hope is that this conversation will not only enrich our perspective, but also identify the policy and program gaps that we, as advocates, practitioners, researchers, must work together to address. So we are honored this afternoon to be joined by distinguished speakers. So we have with us Dr. Romulo Nieva Jr. from the UP College of Public Health, Dr. Emma Plugge from the University of Southampton and of the International Journal of Prison Health, and also joined by Jail Superintendent and Dr. John Paul Borlongan from the Bureau of Jail Management and Penology. Their expertise and experience will guide us through the realities, challenges, and opportunities for promoting health in detention settings. And before I conclude, I would encourage everyone to actively participate. Please take this chance to listen closely, learn from the presentation, engage in the discussion, and even share your questions and reflections. We might not be able to address all of these, but this will give us guidance as well on how to further the discussion beyond conversation, but real action afterwards. So we can use all of these so that we can all move together in a direction that will really help the population that we are talking about this afternoon. So thank you once again for your presence, everyone's commitment, and willingness to be part of this important conversation. and I really am looking forward to a meaningful and fruitful session ahead.
Thank you, Doc Cathy, for the opening remarks. So it truly is our collective responsibility to uplift the rights and dignity of all women, especially those who are deprived of liberty. And hopefully this afternoon will help us learn more about how we can do our part in this endeavor. Now we also have the honor of receiving a special message from the Dean of the University of the Philippines College of Public Health, Dean Ferdinand Garcia Jr. Dean Garcia?
Hi, Sai. Can you hear me?
Yes po.
Okay, thank you. So, magandang magandang hapon sa ating lahat. It is my honor to deliver this special message for a webinar that speaks to an often unforeseen or unseen yet profoundly important public health frontier. That is the health and the dignity of the persons deprived of liberty. Detention facilities are seldom at the center of our health promotion conversations. Yet, they house some of the most vulnerable groups in our society. Individuals whose health outcomes are shaped not by choice, but by the environments in which they are placed. Ang webinar ngayong hapon na may temang Health for All, Even Behind Bars, towards Health Promoting Detention Facilities ay nag-aanyaya sa atin na muling pag-isipan ang mga pasilidad na ito, hindi lamang bilang mga dako ng pagkabilanggo, kundi bilang mga espasyo kung saan ang kalusugan, ang karapatang pantao at rehabilitasyon ay dapat magkasama-sama. Buong puso naming pinagtitibay sa Kolehiyo ng Pampublikong Kalusugan na ang adhikaing kalusugan para sa lahat, Health for All, ay nangangahulugang walang maiiwan. Kabilang na ang mga taong pinagkaitan ng kalayaan. Kasama dito ang pagkilala sa natatanging pangangailangan sa kalusugan at kapakanan ng mga kababaihan sa loob ng mga pasilidad na ito na humaharap sa masalimuot na hamon sa aspetong reproductive health, mental health, at panganib sa kalupitang nakabatay sa kasarian. Ang mga ito ay nangangailangan ng mga pulisiyang makatao, makatarungan, at tumutugon sa kasarian. I would like to commend the NIH Health Promotion Program team and our partners for bringing together leaders, researchers from the prison health system, from government agencies, academia, and women's rights advocate. Your collective expertise will deepen our understanding of the systemic gaps that actually persist, while also illuminating pathways towards more equitable, humane, and health-promoting detention facilities. As public health professionals, we hold a responsibility to expand the spaces where health promotion occurs beyond clinics and communities and into institutions that have long been overlooked. May this conversation challenge us to build policies, to come up with programs that are anchored in justice, compassion, and evidence, and to champion the principle that every person, regardless of their circumstances, deserves the highest attainable standards of health. Maraming salamat at naway maging makabuluhan at nagbibigay ng inspirasyon ang magiging talakayan nating lahat sa hapong ito. Maraming salamat po.
So that message truly sets the tone of our webinar today and highlights the importance of our gathering. So thank you, Dean Garcia, for your special message. Now, before we proceed with our program, we want to hear from you. You will see on screen 3 questions prepared by the organizing team. Please answer them with true, false, or I don't know. So question 1, women in prison don't have distinct reproductive well-being needs. Question 2, detention facilities have a responsibility to safeguard the health of pregnant women. And question number 3, there is no dilemma for prison nurses to effectively manage their role as custodians and caregivers. So we appreciate everyone's answers as this will further guide our discussion today. And I see now that 26 of our participants have answered our poll. So you send in your your answers, sorry. Six of our participants have answered the poll. So if you haven't sent in your answers, kindly please do so. Okay, we will be closing our poll in a few seconds. So if you still want to answer, kindly answer the poll that is being shown in your Zoom. So, okay, I think we have all our answers in. So, from your answers, for question 1, 79% of the participants say that it is false that women in prison don't have distinct reproductive well-being needs. For question 2, 97% of the participants agree that detention facilities have a responsibility to safeguard the health of pregnant women. And last, for our last question, 73% disagree that there is no dilemma for prison nurses to effectively manage their roles as custodians and caregivers. So, thank you for your answers, and we will get to know more about these particular topics as we go along with our session. So, moving forward, we have Dr. Romulo F. Nieva to give us a presentation about how women in prison often face complex health needs shaped by prior trauma, poverty, and limited access to care before incarceration, and how health promoting detention aims to create an environment that safeguards and improves the physical and mental and social well-being of persons deprived of liberty. So Dr. Nieva is an associate professor from the UP College of Public Health and an editorial advisory board member of the International Journal of Prison Health. He is an expert in evidence to policy translation and health politics with experience in communicating research to influence policy. He is also a policy communication fellow at the U.S. Population Reference Bureau, skilled at translating complex research into clear, actionable messages for policymakers. So Dr. Nieva, the floor is yours.
Thank you very much, Tyrene, for the introduction. Good afternoon, everyone. Good morning to Emma, who is also one of the speakers for this conversation. Dr. JP as well is joining us today. Okay, allow me to share my slides. So again, good day to everyone. Mabuhay. I am Roms Nieva Jr. I'm a faculty member at the UP Manila College of Public Health. Our conversation today will center on having a reflection around this question. So what does a health promoting detention, it could be prisons or jails, for women look like? And what are the implications for policy and practice? So most of the data for this presentation were based or lifted from my dissertation, from my PhD thesis, when I did my PhD at the School of Social Sciences at the University of Otago in Aotearoa, New Zealand. So our conversation today will center on 4 themes or area. First, we're going to unpack why we need to focus on women's health need in prison, and then zoom in on what is the Philippine situation and what does a health promoting prisons or jails for women or female deprived of liberty look like, and how can we institutionalize or support a health promoting detention facility. I'd like to begin by sharing this story of one of my research participants, and her name is Leslie, not her real name. She's one of the women who experienced pregnancy while she was incarcerated or while she is in detention. Sabi niya, she says, napakahirap po sa loob ng kulungan. It's very hard to be here in prison, especially if you are a pregnant woman. Kahit na maraming tao sa loob, although it's a crowded place, it feels very she felt she was alone because she was detached or away from her family. Especially if you're a pregnant woman, mas kailangan mo, you need your family and support. Siguro, kung hindi ako nakakulong, baka hindi ako nakunan. So she articulated if she wasn't in prison, she could have saved her baby. So she had her miscarriage inside the facility, and that was her first pregnancy. So this story reflects her motherhood started and also ended in prison. This story reflects the challenges of women and mothers with babies and other women in detention. Hence, it shows the gaps in establishing a health promoting facility, but also shows us what are the areas that we could support the facility, may it be research, policy, and advocacy to address their unique needs. Why focus on women in general? If you look at the data here, globally speaking, only 2 to 9% of the national prison populations are women. So napakaliit po ng numero ng mga kababaihan sa loob ng detention facility. So they are considered a minority in the prison population. Because of this number, their unique needs are often overlooked. There's also increasing number of women globally due to various factors. One of the challenges in detention globally is overcrowding due to changes to policy. For example, the punitive drug laws, limited facilities, and also lack of policy to explore alternative to imprisonment. A significant number of people have been imprisoned due to drug crime. So if you look at the data here, for example, here, significant number of people have been imprisoned due to drug crime, right? And if we zoom in, for example, in this data, based on US data, more women have been imprisoned due to drug crime if you compare it with their male counterparts. And if you look at the general picture, it shows that women are sentenced due to petty crimes or non-serious crime. For example, drug crime, it's the orange one, property crime, and also non-violent crime. So they have been imprisoned because of these non-serious crimes. So now let's zoom in on why we have to focus on the unique needs of women or women deprived of liberty. Many women who enter prison usually come from the margins of society and disadvantaged background. They are also mostly of childbearing age. Many are mothers and some are pregnant women. Hence, they have a complex and unique health needs. The prison reproductive health care and pregnancy support in many countries is not a priority policy area, especially in low-income countries. And in one important information that we need also to highlight based on this study globally, that women have complex health needs resulting from poverty, drug use, family violence, and poor healthcare behavior even before their imprisonment. One glaring data that we also need to highlight is the mental health need of women. So mental illness is overrepresented among women in prison based on this data. Other health needs that we also need to highlight is number one, limited access to menstrual pads and hygiene facilities, insufficient psychosocial, mental health support for them. As I mentioned, mental health diagnosis is overrepresented in this prison population. One vulnerable group in the prison population are pregnant women. So if you look at the data here, based on literature, women are more likely to experience poor nutrition status, affecting the pregnancy outcome, such as being born preterm, having low birth weight, and miscarriage. In fact, based on the US data, higher rates of miscarriage in US prison were reported because of lack of adequate antenatal care, treatment or lack of treatment for drug withdrawal, and limited nutritional support. In prison research, we have this concept around pain of imprisonment. So when you say pain of imprisonment, these are the deprivation that people experience while they are incarcerated or inside the facility. Although yes, all people of all genders experience different pains of imprisonment, women have specific gendered pain of imprisonment because of their distinct health needs and also how the services are designed and the infrastructure are designed inside the facility. So lots of experts have theorized that women prison are often organized and managed exactly like men's, thereby not recognizing women's various distinct needs. So now let's zoom in on what's happening in the Philippines as our case. Does the country reflect the global reality? The Philippine correctional system is considered one of the most overcrowded in the world. So we can see the number of women in the Philippines has dramatically increased since 2001. And there is a noticeable increase from 2016 to 2018 because of the previous administration's war on drugs. But based on the current data, there is also a trend. It's decreasing because of the current efforts of the government to address this problem. So here, I'd like to emphasize that based on the data that I was able to gather, that majority of the crimes, the women, for example, at the correctional institution for women and other prisons were accused of drug-related, which actually reflects the global data that most women are imprisoned because of drug crime. Most of the women are also aged 40 to 59, followed by younger women aged 22 to 39. So these are women of reproductive age. One important data I'd like to highlight is that there's no conjugal visit for women's prison. So by default, the common policy is there is conjugal visit for men, but not for women in women's prison. But I think jails they allow conjugal visit. So conjugal visit is like the intimate time or quality time for people deprived of liberty. My colleague, Doc JP, later maybe will explain the details of this policy. So one important data that I'd like to highlight that Philippines has higher proportion of female prisoner in the whole prison population than the global or Asian average based on the latest data. So for example, the global average is 6.9. If you remember from my earlier data, it's between 2 to 9%. The Asian average is 6.7%. But here in our country, in the Philippines, that's 11%. So 11% of the entire prison population ay kababaihan, women. So I'd like to now zoom in on the experiences of women based on my study. So this is a qualitative project wherein I had conversation, I did interviews with women with various reproductive health needs. For example, pregnant women, women with reproductive cancer, women with menstrual problems, and other problems related to their health needs. So here, based on conversation, these are the common stories that I was able to generate. So first is the limited autonomy over their health needs. Second, limited capacity to manage their needs or discomfort or reproductive health discomfort. Despite the challenges, women were able to cope collectively. So what we call the social network as the coping resources. And what are the institutional changes that I was able to observe to support the pregnant women and mothers with baby. So let's begin with the first theme. So this theme describes the common experiences and challenges experienced by women, such as lack of timely care, reduced opportunity to control healthcare, and also the complicated processes before being sent to the hospital. So they have to get this DOJ permits or a court order. So it's not a seamless process that, if they decide to go to the hospital today, it doesn't mean they can be allowed to go outside. So there is a process that they have to follow. So for them, it's a bit, so it has an impact on their autonomy, especially for pregnant women. There's also a feeling of disempowerment that was expressed because of not being transported early to the hospital for prenatal and also during labor. In fact, one of the participants, Leslie, not her real name, she said, that was the most difficult part of my life. I felt helpless. I was alone. I could have saved my baby. She's actually had a miscarriage in prison. And this data was also published or part of the published book that we did last year. The second storyline or theme I want to highlight is the reduced capacity of these women to manage their reproductive health needs. So women's challenges of coping with discomforts were actually a result of limited resources, lack of institutional and family support. So for instance, one of the participants stated, napkins or menstrual pads are not adequate. It's also not available all the time. It's not free. It's either you have to buy if you have money or you request from your family or friends. Although there were also instances wherein the facility provide menstrual pads or also donations and support from NGOs. And the common challenges of pregnant women centered on their experience of limited prenatal care. In fact, some informed me that they were not able to receive supply of iron and vitamins as part of their pregnancy or prenatal support. So despite the challenges and disempowerment of these participants, very palpable from their story is how they help each other. And the social network serve as the coping resources. So of course, common source of support ay yung pamilya and also their prison peers. Source for financial and material support. They share resources to buy food and other basic needs, and also source of emotional support. In literature, we call it the prison peers. How prison peers play a family-like role. So, for example, one of the participants said, "My nanay, my mother here in prison is very supportive. I call her nanay because she always gives me advice and lessons how to manage my needs here in prison and to survive here in prison." It's not her real nanay, but because of her role as a nanay to her, that's why she always refers her as nanay. A lot of women were also very thankful to the prison staff, NGO, and RVO means religious volunteer organization for the support. Like prison staff and management, they share resources, especially to buy materials for the baby and also to support other needs of women like buying menstrual pads. RVOs, NGO provided materials and support for pregnant women and also for other PDLs. For example, Clara says, "Nagpapasalamat po ako sa staff. I'm very thankful to the staff because of the donation. Also, they contribute to buy mga gamit or materials or to sustain the needs of my baby." So the last theme circles around what are the institutional changes to support pregnant women and also the reproductive health needs of women. So when I reviewed the documents, actually there were lots of changes being instituted by prisons and including jails, like guidelines on the treatment of pregnant PDL and PDL who have given birth and their infants. So they have actually policies like pregnancy care, breastfeeding promotion, no restraint or chain during prenatal visit and labor. Before, it was a practice wherein they put chains, pinupusasan, but because of this policy, it was removed. There was also institutional support for pregnant women and mothers with baby. They were able to hire more medical staff, health education and promotion by health staff and NGO, and also collaboration with LGU. But a lot of, based on my focus group, my FGD with the medical staff and the prison management, they acknowledged that there were still challenges implementing these guidelines because there were challenges beyond the prison system that needs to be addressed as well. So some example, for example, that I want to show here is based on the BUCOR policy, the Bureau of Correction. So they have actually those policies around pregnant PDL and also infants born to PDL. So both sections 4 and section 5. And for the BJMP, they have actually many policies or existing policy to support pregnant PDL and also nursing women. My colleague, Doc Paige, will later probably share the details of these guidelines. So we have the conjugal visitation. So they allow conjugal visit for women, policy on lactation station, and also other guidelines related to child-friendly area in their facilities in jails. So also I'd like to highlight what is the difference between prison and jails here in the Philippines. So although John Paul is here, but in the general difference is if it's 3 years and below, if the sentence 3 years and below, so that's jails. And for prison, it's 3 years and above. Another is for the pre-trial, so those individuals waiting for the court decision. So that's the difference here in the Philippine context, because in other countries, there's no jails and prison. So it's just one facility and being managed by the same agency. But here in the Philippines, jails are managed by the Bureau of Jail and Management under DILG, and the prison is being managed by Bureau of Corrections under the Department of Justice. So we have these two different structures. So what are the remaining policy challenges beyond our prison that we also need to unpack? So the first is we don't have specific legislation supporting pregnant women and mothers with babies in detention. So although we have this national law, the Magna Carta for Women, and there's specific section there, services and intervention for women in especially difficult circumstances. So we have this specific policy, but there's no specific articulation about supporting pregnant women and mothers with baby. And in fact, the language around alternative to imprisonment, so pwede bang hindi sila ikulong? So those are some of the gaps in our national legislation. One policy challenge is, although we have a very comprehensive reproductive health law, our existing law does not explicitly state the maternal health care of pregnant women and mothers with babies in prison. And we have no legal framework, we have no robust legal framework or legislative intervention that would allow alternative to imprisonment, similar to other countries like community sentencing, maybe a house arrest, or sentencing delay. So now let's zoom in on, given these challenges and the complexity of this challenge, so what would be the role of facility in promoting? So at the facility level, what can they do to provide an avenue that is health promoting to the PDL, especially for women deprived of liberty? So based on the concept of this by Gatterer and colleagues, so they frame detention could also be a health promoting setting, so a settings approach in health promotion. So they define a health promoting detention as a place of detention in which the risk to healthcare are reduced to a minimum, although they acknowledge that there are limitations and restrictions, but the health risks could be reduced to a minimum if we have this kind of setting. There's also a caring atmosphere that recognizes the inherent dignity of all prisoners and their human rights. And this requires a whole prison approach to promoting health and welfare as part of the norm or policy. So based on their book, they were able to articulate or show what are the necessary arrangement that could be done to promote to establish a health promoting prison for PDLs. So first, to strengthen community action for health, and so that requires collaboration across different agencies, build a healthy public policy, develop personal skills, especially for PDLs and also for the staff, create a supportive environment, infrastructure, the processes and the policies, and also to provide capacity building for our healthcare staff to ensure that our health programs are provided appropriately. So how can this be applied to women given that they have distinct or unique health needs? So here, based on the book of Waddell and colleagues, so they were able to determine what are the necessary requirements for a health promoting prison or detention for women, building on the initial framework. So first, to have a health promoting detention for women, first it should be gender responsive. So the prison needs to understand that women has these unique or distinct health needs, reproductive, menstrual, and even their past experience before imprisonment. That's why we have this trauma-informed, given that women had traumatic experience before their incarceration. Substance use programs. We have also respect for privacy, hygiene support, adequate nutrition, protection of rights and safety. The non-negotiable is to have a regular family contact, including the visitation support, education empowerment, health education skills, and livelihood training to allow also women to earn while they are in prison, but also as you prepare them for their integration program before they will be sent back to the community as part of your re-entry program, and also the continuity of care. The links to community health, there should be, if the facility or the prison or jails are unable to provide comprehensive program because of limited resources, at least they have that kind of a network or collaboration to link the patient or the PDL to outside support or service. So now let's zoom in on the what do we have policies or standards, global standard that will enable or support the Philippine government? The answer is yes. We have global, we have the UN standard for the rules for the treatment of prisoner. We call them the Nelson Mandela rules for all PDLs. But we have also the UN rules for the women offenders, the Bangkok rules. So we have these mechanisms, global mechanisms that we could always refer to. And if you look at these rules, these guidelines, especially for the Bangkok rules for women, there is an articulation there that the management should factor in the women's specific health needs and state that the women prisoners must be comprehensively screened for health problems and their unique health needs identified upon arrival in prison. In addition, there's also a statement around the accommodation of women prisoners shall have facilities and materials required to meet the women's specific hygiene needs, including sanitary towels provided free of charge and regular supply of water. As I highlighted earlier, one of the challenges of prisons and jails is the overcrowding. So our prisons are extremely crowded. So if you look at the language of the UN Bangkok rules, it explicitly states that non-custodial sentences could be explored, especially for pregnant and women. So we have these recommendations on alternative to imprisonment. So baka pwede hindi sila ikulong given their circumstances. So the question, do we have experiences or cases in other countries wherein they applied alternative to imprisonment? So the answer is yes. So for example, these countries like Brazil, Ukraine, and Ecuador, so they actually practice house arrest with electronic monitoring. So in Brazil, for example, pre-trial detention is substituted with house arrest for all pregnant women. So because of this alternative to imprisonment, they were able to reduce the number of PDL and also decongest jails and prison because of this non-custodial policy. So how about in our neighbors? Do we have those kind of policy? The answer is yes. In fact, in China, criminal, procedural, and prison law have been modified to allow pregnant and breastfeeding women to serve their sentences in the community under a 2-year supervised release arrangement. So it's already being undertaken in China. In Malaysia and Vietnam, plans are underway to introduce home detention as a non-custodial alternative to vulnerable people in conflict with the law. So to end my my session, I'd like to highlight these 4 points. So first, prisons, jails, or detention facility create distinct challenges and even amplify existing needs for women, especially for pregnant women, women with menstrual discomforts, women with limited resources. Women's imprisonment also has been framed as a reproductive justice issue because of the gendered pain of imprisonment. Men and women have various needs and experiences while they are in prison, and also other genders. Hence, detention can provide an avenue or a space to help address the needs of women in particular. So we have a health promoting setting or detention to address those needs, and also to provide or to prepare them as part of the re-entry or reintegration support for PDL. And lastly, based on my experience with my project, listening to the story of these women, especially pregnant women, women with reproductive cancer, women with reproductive discomfort, it will actually allow us to improve our policy and practice, to have a more grounded, evidence-based, and compassionate policies and programs for this group. So thank you very much for your time and for listening.
So thank you, Dr. Nieva, for that insightful presentation. So that truly highlighted the need to take action and give importance to the distinct health needs of women deprived of liberty. And hopefully this has given everyone an idea of what we can do as practitioners, researchers, and advocates to address these specific issues. So as we carried the insights from Dr. Nieva's presentation, we are now moving to a panel discussion facilitated by Dr. Nieva. And in addition to Dr. Nieva, we will be joined by two panelists. So first, I would like to call on Jail Superintendent John Paul de Guzman Borlongan, MD MPA. So he is the current Medical Division Chief of the Directorate for Health Service at the BJMP National Headquarters, a licensed physician and public servant with the rank of Jail Superintendent. He leads the national jail programs, ensuring the delivery of quality healthcare services in correctional facilities. So Dr. Borlongan has served in various leadership roles in BJM since 2014, including as Chief Health Officer of Region 3, the National TB Coordinator, and Roaming Medical Officer in multiple regions. He is a researcher, trainer, and advocate for health detention, and a member of several professional medical and public health associations. Known for his commitment, integrity, and innovation, he continues to champion improved healthcare systems for persons deprived of liberty. So joining us also is Dr. Emma Plugge. So Dr. Emma qualified as a doctor and undertook postgraduate training in tropical medicine and primary care, working in the UK and overseas as a clinician. She subsequently trained in public health and also completed a doctorate at the University of Oxford. Her research now focuses on the health of marginalized groups, particularly the health of people in contact with the criminal justice system and the health of migrants. She is currently involved in a number of research studies investigating communicable and non-communicable diseases in prisons in the UK and internationally. Her work has a particular focus on the health of women and the meaningful involvement of marginalized groups in research. And to moderate, we have Dr. Nieva. So, Dr. Roms, I give the floor back to you.
Okay, thank you very much, Cyrene. Hello, Emma. Nice to see you again, Emma. And hello, John Paul, Dr. JP. To start our conversation, I'd like to get your thoughts on my presentation earlier. Maybe just a quick thoughts or reflections of that presentation. Maybe we could start with you, Dr. Emma, before JP.
Can you hear me?
Yes, Emma, loud and clear.
Fantastic. Gosh, I've had so many technical problems this morning, so it's a pleasure to be here anyway, and I feel very honored to have been invited. And it's been such an interesting, for me, early morning. But so thank you for inviting me. I think your question asked about the response to your presentation. I think it was a fantastic presentation. There were a number of things that that really struck me. I think the increase in women in prison is startling and quite shocking, actually. And I think that sort of takes us back to the issue of which, the Bangkok rules actually highlight. Do women even need to be in prison? Actually, 20 years ago, there were just over 3,000 women in Philippine prisons. Now there are over 20, approaching 22,000. I mean, it's a shocking increase. And I think we have to think about what does that tell us about probably the conditions outside prison. I know you've had some fairly draconian legislation around drug laws, and that has led to that increase. But I would really want to look at that and think very carefully. And you gave that lovely presentation about those lovely slides about other countries for pregnant women who have alternatives to imprisonment. And I think, however unpalatable it is to our governments in the countries we work in, I think we still need to highlight the need for alternatives to imprisonment for women. And I think, and I love Dean Jun's words about evidence and compassion. And I think we need to be thinking about, what is the evidence that actually locking these women up is doing society any good at all, let alone the women themselves. But what is it doing for society? So I think it's really important when we talk about women's imprisonment that we always think there are alternatives and we question what women are doing there in the first place. But I think the other thing that struck me about your presentation, and of course I'm familiar with your excellent work, was that there seems to me in prisons, jails in the Philippines, that actually what you're saying, that there are existing guidelines for these women, but there's just a lack of implementation. And so I think I'd be very interested in kind of unpicking that a lot more. Why is that? Why do these exist? And we have obviously the international guidelines that are influential, but of course they carry no weight if a government doesn't really want that they are but guidelines. But it's interesting that within your prison system there are these potentially existing guidelines, but a lack of implementation. I'll finish there.
Right. Thank you, Emma, for sharing your insights about the presentation. JP?
Yes,
Jean-Paul, go ahead.
It's also my pleasure to be part of this webinar. I hope this will be informative, especially for those who are not yet aware of the situation of our jail system in the Philippines. So maybe I will start muna with a backgrounder on what's our correctional system in the Philippines. Because more of your presentation, especially your study, was all about the CIW, the correctional for women in Manila, wherein it is under the BUCOR, under the Department of Justice. And for the audience po, we have a very fragmented system of jail and prisons in the Philippines, like what Dr. Roms earlier presented. But I will further present it with so that you can really capture or understand our fragmented system in correction. So first, in the study of Dr. Roms, he discussed about Bureau of Corrections. Yung Bureau of Corrections is under DOJ, Department of Justice, and they have 7 penal colonies all over the country. One of which is the Correctional Institute for Women in Mandaluyong. And 6 others, including one in Muntinlupa, compose the 7 penal colonies of Bucor, wherein the prisoners who or the PDL serving more than 3 years up to life imprisonment are detained in those 7 facilities. Compared to BJMP, Bureau of Jail Management and Penology, pre-trial and short-term conviction, 1 day to 3 years. Those are the type of PDL that we take care of. Although because of our justice system, usually delayed, some PDL can stay in our facilities for more than 10 years or so. Okay. But we also have provincial jails. In the Philippines, we have 64 to 65 provincial jails. Provincial jails is also under the DILG, which is supported or being administered or supervised by the governors in our country. Most of the provincial jails we have already transferred to BJMP. 64 to 65 are remaining to be under the LGUs. Compared to BJMP and Bucor, provincial jails contain PDL serving 3 years, varies in 3 years, and for those who are to be transferred to Bucor. And we should never forget PNP custodial centers. PNP custodial centers, there are more than 470 custodial centers. So those are the major jail system that we have in the Philippines. BJMP, Bucor, provincial jails, and the custodial centers. I am only representing BJMP, but most of the discussion covers BJMP and Bucor. And that will be our discussion for this morning. I will validate most of the presentation and subject matters of Doc Roms regarding her presentation. Yes, as Ma'am Emma commented, that we have a lot of policies. Yes, because as other countries would say, Philippines are very good in making guidelines and policies in writing. But in the implementation, we have to review and study our implementation. Um, the BJMP, we have 488 facilities nationwide. Out of 488 facilities nationwide, we only have 91 female dormitories. And out of 106,000 plus PDL, we have 9,783 PDL female prisoners. That is composed of 8.41% of the total jail population in BJMP. Out of the 9,783 female PDL, we have recorded 104 pregnant PDL. So for the audience po, we have pregnant PDL because during their commitment, they are already pregnant. So don't think that they became pregnant when they while in detention. So I repeat, from the time of their commitment, they are already pregnant. No female PDL should be pregnant inside the facility. Okay. The conjugal visitation policy was also mentioned. So that came up because of there are clamors or there are discussions that there should be equality between male and female. Conjugal visitation in other countries is called family visitation. Here in the Philippines, it's a different context. Conjugal visitation, like what Doc Rom said, is the intimate visit of the lawfully or legal partner of the PDL, of male PDL, and they will have an intimate R in the jail. Because of equality, there should be equality between male and female. In, I think, if I'm not mistaken, 2019 or 2020, the policy on conjugal visitation was reviewed, and it was approved that female PDL can also be allowed to have that kind of visit. So we have discussed, even though there are some questions, because there should be, as I've said, there should be no PDL, female PDL to be that should be pregnant while in detention. So in the policy, we included that there should be injectable contraceptive before they can avail of that privilege. As of now, there is only one female dormitory, that is Quezon City Jail dormitory in here in Manila, who have a good implementation, not good, who is implementing correctly that said policy. The rest of the 91, we have still to study, because even though we have the policy, they are the one who don't want to implement that. We also gather the consent also of the PDL concerned, and they're also not amendable on that kind of implementation. About I mentioned about the pregnant. There are issues on how to during screening of a new committed new commitment during intake procedures. There we have screening, but on the part of the OB/GYN history, of course, only the female PDL should have that, but we should it should be more comprehensive, and we should also expand, because the only question on that part using our tool is knowing the how many times did you become pregnant, what's your last menstrual period. That's it. No more beyond that question. So I think reviewing also the Bangkok rule and other reproductive health pertaining to women, we should also review if we can apply it in BJMP or here in the Philippines, so that we can comprehensively and holistically capture the whole picture of the whole health presentation of a female individual who is committed to PDL, so that there should be continuing of treatment, and we can capture whatever we can give her, whatever services that she needs. I also just knew that we give our PDL, both male and female, hygiene kits, but there is no provision of the sanitary napkins or tampons. But as I ask the appropriate directorate or office regarding the hygiene kits, they are now making a policy on how to provide or how to list the essential needs of female PDL, and they are including the napkins or sanitary napkins for the PDL, which is, yes, a very is a type of is essential for all women, even in prisons. For now, I will stop on that. And
thank you very much, JP, for a very comprehensive response to the presentation. So basically, there are different layers of problems that contribute to the complexity of the needs of women, from overcrowding to limited resources, and given the even the issues around policy implementation. There are many policies already in the Philippines, but the implementation varies, but there are also policy gaps beyond the prison system. So for example, national legislation is needed to address, for example, drug use. Maybe we need to revisit the existing or the current drug policy, and also exploring alternative to imprisonment, right? So the one based on the conversation and based on your sharing earlier, one particular issue that is very palpable in the prison is overcrowding. And overcrowding has a huge impact on the health needs, even the infrastructure, and even how the management has to prioritize, given you have this growing population, especially for women, incarcerated women. Maybe your thoughts how we can address overcrowding, because it has a ripple effect, right? Based on study. Maybe your thoughts, Emma, about how we could address overcrowding based on your experience, or based on the UK experience, or your experience working with different agencies. Before I'll ask JP from a practitioner point of view, being working inside the system. Go ahead, Emma.
Yeah, I mean, I think overcrowding is a massive health issue, and Roms, I think earlier you said it very nicely about the amplification of health needs that happens when people, specifically women, particularly women, are imprisoned, and I think that's a real issue, and it's even worse with overcrowding.
Mm-hmm.
And I think we really need to question whether you can have a decent regime with when things are overcrowded, and what purpose it really serves wider society.
Right.
when actually, yes, we're still punishing women, but is there room for rehabilitation when
Right.
when prisons are so full? Certainly in the UK, we see that imprisoned people when in an overcrowded prison, they're not getting out so much, they can't get to education or all those activities, that really it is just simply containment rather than any positive rehabilitative function. And actually, are we bringing women in, containing them, further traumatizing them, because we've touched on the trauma, but it's a massive, absolutely massive issue, and sending them out in an even worse place and position, and probably to commit the same crimes.
Right.
That's bad for the women, it's bad for the families from whom they've been separated, it's bad for society. It serves nobody well. So yes, quite what we do about it. I think, again, it comes back to my, the drum that I will keep banging about alternatives to imprisonment. But it's also about government policy, about who they decide to lock up. So if you have extraordinarily punitive drug measures for women, it will increase your population. And I come back to those wonderful words of evidence. Really, what works best for these women? Is it putting them in prison, or actually is it having community services that and some sort of other detention, and of course some sort of punishment, some sort of if they've transgressed, but actually, does it serve them better? Does it serve society better? That in the community getting effective drug treatment.
Right.
And so I think we need to think carefully around that. I think it was very interesting. We've seen in the last 5-6 years from the UK experience two sort of waves, if you like, of attempts to reduce our prison population. The first, obviously, during COVID, but to reduce the prison population, and the second more recently with our newish government now, trying, because our prisons were about to kind of explode, get too overcrowded, and so they had to release a lot of people early. And I think the problem here is, I think we forget from where people in prison come, that actually often they're not coming from comfortable, stable lives, that actually the community, society is extraordinarily tough for them. And you know, when they go back into their, for women, it's often they go back to unsafe homes where they are victims of domestic violence, and poverty, and you know, we're not talking about we're sending them back into wonderful conditions. So I think you have to think really carefully about where those women go, how are they then supervised, and how do we enable them to become our good neighbors, as the Scandinavians always look, you know, our future good neighbors. How do we enable them to become productive members of society that give back? And I don't think that's straightforward. I think that's really difficult. It's about, you know, we're straying very much into politics now about the choices we make about our education systems, about our housing, how we provide housing, how we provide all those sorts of things.
Right. Thank you. Thank you. It reminds me of the concept of gendered pathway to prison, you know, that women have different, you know, reasons why they come in contact with the prison system. And most of these women, if not all, have life histories of trauma and negative experiences that could also affect their behavior in prison, right? And even how we addressed the system given those background. Maybe this is my last question before I open the floor for our participants to ask their questions. Maybe at the local level, JP, as a practitioner, what could be done in terms of the like establishing a health promoting facility or detention facility to address those structural barriers or gaps like overcrowding, maybe limited policy support, if that's appropriate to frame that way, and also like training for the staff. I am aware that even hiring of the staff, of the medical staff, it's not the Ministry of Health or Department of Health, correct? It's still under the so even the governance, it's not health.
Yes.
Right. Go ahead, JP.
In terms of the how to address overcrowding, connecting it with the jail planning and design. Most of our jails, 488 of which are we just received it when we became a bureau in 1991 from the local government, and so we cannot expand most of our jails. That's why there is overcrowding. But with the help of the government, especially the past administration, they supported on establishing or enhancing a jail. So we have expanded. One example is the Kansas City jail. From Kamuning, we transferred it to Payatas, and from 1,000% overcrowding, we have decreased it to less than, now it's not overcrowded. But in general, most of our jails, we have a 416% overcrowding rate. How to address that? Focusing on the female dormitories, as far as I know, out of the 91 female dormitories, there is no overcrowded female dormitory in BJMP. And comparing to male dormitories and female dormitories are more neat, more organized. They have a lot of beautification going around, more conducive. Maybe because of the culture or the character or behavior of the female PDL compared to the male PDL. But my issue or concern is about the privacy and confidentiality, since compared to other countries where they are observing solitary confinement, because that is their culture, more on privacy and confidentiality. Here in the Philippines, we cannot do that. We cannot do solitary confinement or buddy system, meaning there should only be two individual in a room or in a cell. In the Philippines, we cannot do that because of the limited space. So when a pregnant PDL deliver her baby with postpartum, or no, not postpartum, delivered her baby, she would opt to um, she would opt to give the baby to her relatives outside the jail, or not to be with her in the jail. Although we have a policy of at least one year that the baby can stay in the facility, so that they will have lact- uh, more be more close to each other, have lactation and nursing, so that they will have connection with the baby. The mother will opt to give the baby to her relative, away from her, because of the security and health safety reasons, rather than carrying the baby with her in the prison. She would rather opt to give the baby to her relatives outside. In case that there is no relative, or she does not trust the relative to take care of her baby, the jail will help her to connect or to coordinate with DSWD, so that the DSWD can take care of the baby instead of her family. That's the situation. Also, we do not allow that that delivery of or birth delivery should not happen in the jail. So all deliveries, like in the hospital, walang baby out sa tricycle, walang baby out while in transit to the hospital. Because it's not acceptable. Also in the jail, the system or the thought is there should no baby that should be born in the hospital, because alangan naman na we will put in the death certificate where the baby was born, in Quezon City Jail, and we are protecting the right of the child. So as much as possible, we have to BJMP should transfer and transport the mother who is in labor. Actually, the jail nurse or the jail unit should also know the time of delivery, so that there will be preparation and coordination with the hospital or lying in clinic, that during the time of labor, should the pregnant PDL should also be transferred or transported the to lying in clinic or the hospital, so that there should be no baby out while in transport. Another concern is that female PDL, of course, lesbian are also female. We are overcrowded, or we have limited space only. So there is an issue on that in terms of privacy, confidentiality, and although we don't stigmatize lesbian, but we also have to be sensitive with the feelings and comfort of the female, and also their companion, the lesbians in the jail. So we are trying to solve or find solution, or to address how we can do that. Yeah.
Okay, thank you very much, JP, for the clarifications and also response to the question. Maybe to maximize time and also to allow our participants to also engage with the speakers, I'd like to ask Cyrene. Cyrene, what would be our arrangement?
Hello, so thank you panelists for the discussion. Now we will be proceeding to the questions from our participants. So some of them have sent in their questions through the Q&A function of the Zoom room. So how we are going about it, I will be reading their questions to you. I think they have a few questions here, and we will give you time to answer. So our first question, this is specific to Dr. Roms. So research on women in detention is still relatively limited. What gaps should future Philippine studies focus on to strengthen evidence-informed policymaking? So Dr. Roms?
Okay, thank you. Really good question. Well, we have already data to that establish that incarcerated individuals like PDLs have unique needs. So that is already established. So in terms of like research area that could be explored to help our policymakers, maybe we could explore like alternative to imprisonment, like what arrangement that could be done, because there are different forms of alternative to imprisonment. So we could explore that. And what are the specific arrangement that could be instituted in the Philippines given our resources. The second is also the issues around drug use. So that's something that we also need to explore, especially among women, because it was a part of my project. But although I'm aware that there's also a growing research around drug use in the Philippines, but something that we could also look at, because again, what's happening in prison is a product of these different layers of problems about drug use, punitive drug law, lack of alternative to imprisonment, right? And other vulnerable women, for example, elderly women. During my visit and also my data collection, I had conversation with elderly women, like women like 60 and above. So I think we have also to look at their distinct health needs while they are incarcerated and what could be done, maybe an alternative to imprisonment, especially for elderly and women with chronic conditions like reproductive cancer and other chronic medical conditions. Yes, thank you.
So thank you, Dr. Nieva, for that answer. No? So for our next question, somewhat connected to the previous one, but this time it's specifically for Dr. Emma. So how can detention facilities balance necessary security measures with the need for privacy, dignity, and quality care for women?
I think that's a difficult one. I think they can. I think probably it's very much an issue almost at a, I mean, if you're assuming the women in there have to be in there, because that's always my starting point. I think it goes back to, I think Rom's put up that really nice diagram about the health promoting prison, and about all those, I think that were the 6 sort of building blocks of a health promoting prison. And I think those are absolutely key in addressing those. And I think it has to be done sort of it can be done at a local level. I think what has struck me when I've been in my kind of years of working in prisons is how much one prison differs to the one next door, and local leadership, local kind of visionary leadership can be so key in that. So if you have the head of your prison saying, this is what I want, this is what I expect, and bringing the staff along with him or her, then I think that can happen. But I do think it has, the prison system is very hierarchical, and that leadership must come from the top, and there need to be safeguards in place that happens at the bottom. But you know, that health promoting prison, that trauma-informed care, because actually these women are traumatized, and we need to perhaps sort of revisit the kind of central tenets of trauma-informed care, things like you know, respect, collaboration, care, and empowerment, choice, all those things that actually seemingly could conflict with a prison punitive regime. And think, what does that look like in this prison? But I think, you know, there's quite a lot of evidence out there about what we should be doing. But I think at a local level, to make it happen, you need to get the head, whoever is in charge, on board, and willing to make changes. They're likely to be changes that actually don't involve a lot of money. It's a cultural shift. It's a mindset shift. Thank you.
So thank you, Dr. Emma, for that very insightful answers. I think we have time for one more question. This time it's for Dr. Borlongan. So regarding the Joint Administrative Order number 2014-001 issued by the DOH, DILG, DOJ, PhilHealth, Bucor, and BJMP, we understand that it was passed last year, so 2024. So one of our participants wanted to ask which provisions specifically address and support women's needs and rights, and what is the current status of its implementation?
Actually, that joint administrative order, which was passed last June of 2024, it is a general policy covering all PDL, not necessarily female, not necessarily vulnerable group, but there is there will be ongoing TWG, technical working group, to draft and to discuss the implementing rules and guidelines. So we are still on that stage. What is clearer at this moment is that all of the PDL of BJMP will be covered by our national health system, the PhilHealth. And we have talked to PhilHealth, and they are very open to help and assist BJMP, that regardless of the status, regardless of gender or sex of the PDL, everyone will be covered. That's the status right now. So we are waiting with the DOH on when will be the next meeting so that we can move forward in order to make a reality all the sections or subjects or topic that can be covered by that JAW, by that joint administrative order.
So thank you, Dr. Borlongan, and the rest of our panelists. So unfortunately, due to the interest of time, we need to move on from our Q&A. But thank you again for that amazing discussion, and I definitely appreciate the insights into the unique health needs of women in detention. I think everyone definitely learned a lot today. So this is truly an area that we can and should pay attention to. So for our participants, I know some of you might still have some questions for our panelists, but again, due to the interest of time, we have to move forward. So for those who still have questions, you may send an email to healthpromo.upm@up.edu.ph. So again, that's healthpromo.upm@up.edu.ph. So you can send your questions to us and we'll get back to you with the panel's response. So with that, we are now moving to the end of our webinar. So thank you again, panelists. So we are pleased to have Dr. Emma Plugge, Professor at the University of Southampton and editor of the International Journal of Prison Health, to give our closing remarks and share the opportunity to publish with the International Journal of Prison Health. So Dr. Emma, I give the floor back to you.
Fantastic. Thank you very much for I will keep it brief. I understand we're over time, but my closing remarks, really, what a fantastic session. We heard from Associate Professor Roms is excellent work in the Philippines, and we've discussed the many problems that characterize prison systems, not just in the Philippines, but globally too. These, you know, there is not a country in the world that is not struggling with these issues. So we started off with some fabulous research, and what I would say to you is change is needed. Curiosity will bring about change. Keep asking those questions. I'm really hopeful that this session has piqued your interest in prison health research. It's really important. If you feel impassioned about the conditions in which these women live, get researching in whatever area. And I would welcome you all in my role as editor of the International Journal of Prison Health to think, do you want a special issue on health issues in prisons in the Philippines? And I've put the link to the journal there and my email there. If you could get a little collaboration of you together and consider that, then I'd be really happy to talk to you about that. But we hear too little from the Philippines, from this area of the world. We want to hear more. And please, it's not just about putting your name on a paper. It's about change. It's about change for the better in this rather, do I say dismal world, when everything looks dark around us. Let's fight, let's change things for the better. And if you're a researcher, please think about publishing, about working in this area, publishing with us, and putting it out there to the bigger world. So thank you all. It's been a really inspiring, for me, morning, for you, afternoon. It's been great. Thank you.
So thank you, Dr. Emma, again for closing out our webinar. So hopefully this afternoon has piqued everyone's interest to this very important health matter. So again, as Dr. Emma said, we could help change the world for the better. Now we invite everyone to answer our events evaluation form. It can be accessed through the QR code currently flashed on the screen and through the link message by the organizers. So your response will help us plan future events of the UP Manila NIH Health Promotion Program. You may answer the evaluation form by 10 p.m. today, and please be guided that answering this is also a prerequisite to receiving your certificate of participation, and that you are requested to answer the survey using the email address that you used to register for the event. As we screen and validate the responses, we appreciate your patience in receiving the certificates, and rest assured, as long as you registered, attended via Zoom, and answered the evaluation form as instructed, you will be receiving your certificate through your registered email address. So we appreciate everyone's support for today's event. If you are interested in joining other HPP events and activities, please follow our social media pages and subscribe to our newsletter through the QR code showed in the slide. So again, that concludes our event for today. To stay updated on the latest happenings of the Health Promotion Program, follow our social media pages shown on screen and sign up to our newsletter by scanning the QR codes. So we hope to see you in future events. And I guess we will be flashing the evaluation form so that you have time to scan the QR code. So thank you again for joining us this afternoon.
Thank you. Thank you, Emma. Thank you, JP.